We're out here at the offices of beautiful Weniger Plastic Surgery. We're going to be talking to Dr. Weniger today. We have a few questions to ask him, some things I've been wondering about. Stay tuned because there'll be a fantastic giveaway at the end. So we're sitting today here with Dr. Weniger at Weniger Plastic Surgery, and we have a few questions that you're going to be gracious enough to answer. And
Right.
It's that time of year that we're all thinking about getting ready for the summer, especially in this town, beach, and being beach body ready. So what can you tell us about some of the procedures or some of the things that you offer that will help us to get beach body ready?
Right, so this is pretty much busy season for body contouring. A lot of faces in the winter, but now, I mean, it's everything to look good in a bathing suit, right? Liposuction, tummy tucks, breast lifts, breast implants, reductions, all those sorts of things.
So I'm a bit of a planner, so how far in advance should I schedule this so that I'm ready and able to be on the beach and not see anything that...
Right. So people ask, how long is the recovery? It means, well,
Yeah.
What do you mean by recover? We're taking our post-op photos generally around 6 weeks. Okay, so that's when, you're looking great. Scars fade for a couple of years. But, someone will say, well, they get their implants, right? They get the breast implants. Well, when can they put their, bikini on and they out by the pool? You can do that in a couple of weeks easily. A lot of times when there are incisions, the question is, when can I get in the water, right? Usually looking at 3 weeks to submerge an incision. Might be 48 hours to take a shower, but to submerge, it's generally about 3 weeks. But if you're just going to be going for it, diving, getting on the boat in rough water, just not worry about anything, that's 6 weeks. So it really depends what you're looking for to do. Do you just want to look good in your bikini? It could be as little as a couple weeks.
That's fantastic. I didn't think it would be that quick. I think for me, my concern is generally because I've had 4 kids.
Right.
And there's certain things that you do after you have 4 kids to try to get your body back to the way you want it to be, but you can only do so much. Like, I eat right, I exercise, and it's great in the winter or colder weather, but during the summer beach body. So what are some of the things that would be not too invasive that I could do that would make me feel a little bit more confident?
Well, I would say that, I'll put it 2 different ways. Sometimes there are very small areas that you can be in great shape and you just have a little, the love handles or hips. I saw a girl just last Friday. She was body mass index 19, which is pretty darn thin. And you look at her like, what is she here for? She just had these saddlebags. You did not expect to see it. That's an easy fix, liposuction, cool sculpting, something like that. That's a quick procedure, like 45 minutes, right? And immediately you look better. More often than not, I'm seeing people who've been with their trainers and they're so down on themselves. They've been working out. They're like, I work out, for an hour every day. I run and I can't get rid of this. They'll say they're bra fat or there's no fat there at all. It's just loose skin. The more weight you lose, the more you're going to deflate the bag. And you just be amazed at how many people have this poor self-image because they think it's still fat that they can't get rid of. And they realize that all that needs to be done is, to have it removed. And that's the one thing we see more often in people who are eating right, exercising, healthy, look great, but underneath their clothes, they're really self-conscious.
I think there's a real stigma attached to breast augmentation, and there's a lot of women out there that are afraid to talk about certain procedures or what they've had done. And I think the older you get, you kind of open up to that. You ask people, you'll be like, your skin looks great, or you look great, what are you doing? And there's certain things, again, that you can't do anything about. If you've had 4 children, if you've nursed 4 children, if you've had a couple of children, it does certain things to your body. And I think a lot of women are afraid to say or to actually do anything about it as well.
Well, I'll tell you what, we're talking about breast implants. There are 2 peaks in breast augmentation. There's earlier 20s, people who just didn't develop, wanted more, and now they have money to do it. But the bigger group of women is after having kids, right? There are a lot of people who are more fortunate if you start out with less breast tissue, right? And after having kids, your milk comes in, they don't maybe get as big or there wasn't as much skin to start with, and you can be lucky and just have involution of the breast deflation, and the skin is kind of still okay. You can get right back to where you were with an implant, like a 50-minute surgery, and probably have a better shape than you started. And most people want to get back to about the same size they were, maybe, full C, something like that. Now, certainly some people are going to want to take that opportunity to go bigger. On the other hand, if you have someone who maybe liked their breast more before surgery, maybe they wear that C cup, okay? And then, they breastfeed and the milk comes in, but usually with breastfeeding, or multiple kids, right? Then there's going to be a lot of drooping because the breast was bigger to begin with, it's heavier, and there was more skin to start. Oftentimes though, when you get involution of the breast, meaning that the volume that was inside the skin, there's less volume and the skin stretched out, and that's your worst case scenario, where things are particularly pendulous and loose skin, and then your choices there are a lift. A lot of people, it seems to me that a lot of people more now than before are happy with just a lift. Take the same amount of volume, put it back up, put the nipple back up into a perkier position.
I think some people have a preconceived notion about maybe what they want or what can be done.
Right.
So actually coming in and having a conversation with you,
right,
is enlightening.
And that's my favorite part of my job, right, is people know kind of what they want and what they want to look like, but don't really know what it takes to get there. So people come in and say, what do you think I need? This operation or that operation? I'm like, hold on. What are you looking for? What do you want? Maybe it's your face. What bothers you, right? Or if it's your body, well, what is it? I mean, someone will say, do I need a lifter, and should I get a lifter or an implant? I'm like, well, let's take a look. It's most important, like in any medicine, to make a diagnosis before you make a treatment, right? So you're not going to go into your family practice doc and say, what do you think? I was thinking about maybe getting a colonoscopy or like a cardiac cath or something. They're going to look at you like you're crazy and say, well, what kind of problems are you having? What kind of symptoms are you having? Same thing. I need to try to figure out what it is specifically that you don't like. Someone comes in and they want liposuction, right? And they've already decided they want liposuction because they've read about it. And when you look and there's no fat, it's all skin. That's a classic one there. You educate me about what you're looking for, I'll educate you about the options, and then we kind of decide together what is going to match up with your goals. Because there are a lot of things that go into it. You might want something, but that's maybe a little more surgery that you really want to get into, like the surgery costs, that sort of thing. So we can look at, okay, well, what options do we have to get you close to where you want, even though it's not maybe exact. And that's where a part of my job is kind of like not just being a surgeon, but being sort of a consultant to help the person understand the field of plastic surgery. Because I'm not going to make the decision for someone's body. I want you to understand. And then we kind of work each other's ideas back and forth until there's something we both agree with.
Oh, that's fantastic.
Thanks for joining us today at Weniger Plastic Surgery.
Victoria has some exciting news to share with you.
Yes, we hope you enjoyed our sit down with Dr. Weniger today. We are doing an exciting summer giveaway, so anybody can enter to win this free Weniger Plastic Surgery Yeti. All you have to do is like this post, follow our page, share this video on your story, and tag 2 friends. Thanks for joining us.